Good morning, and welcome to the weekly dementia blog. My name is Dr. David Hutchings, and these are being sponsored by SpectrumEd. It is now June the 1st, so we're finally kicking off summer, so I hope everybody's got some wonderful summer plans coming up. I have a few questions that have come in regards to how do we go about accurately diagnosing dementia. So I want to cover that today. And then what we're going to do over the next few weeks here is a series where we're covering symptom management. So we're going to talk about the importance of therapies within the diagnosis of dementia to help keep the patient safe and focus on quality of life. So we'll talk about physical therapy and mobility. We'll bring in occupational therapy, which is absolutely critical in the area of dementia. And then we're going to talk about speech language pathology and how they can assist with some of the nutritional issues that we see in dementia. So let's get started. When we talk about actually diagnosing dementia, being that, as we talked about in the previous blogs, there's many different forms of dementia, so it can get pretty tricky. However, there is not a actual set guideline on how we actually diagnose dementia, or let's take Alzheimer's, for example. So what I see a lot of times is that the primary care physicians, they are seeing a multitude of patients every single day. And so it's really difficult on them to be able to sit and do a full neurocognitive assessment and workup on a patient. And it also differs based on the patient's severity. For example, if you have a patient who's, if they're a middle or late stage with pretty severe cognitive issues, we probably would not put that patient through, MRI or PET scan imaging or things like that. So it really kind of depends on the severity as well. But let's talk about somebody who is quite a bit higher level, maybe a little bit past the mild cognitive impairment stage, as we've discussed in previous blogs. So definitely a full neurocognitive assessment. And what I mean by this can be conducted by a neuropsychologist. This can be conducted by neuropathology. So you're going to have, and the neurologist will sometimes do this, but what you'll find is the neurologist or the primary care physician, again, are seeing a multitude of different patients, so they will do a quick assessment, testing memory, orientation, immediate recall, those types of things. The two tests that are done pretty often in those quick workups are the slums or the mini mental. And I would definitely urge us not to diagnose a full type of dementia based on just short screening assessments. So a full neurocognitive workup would definitely be needed. And we are looking at multiple different domains in terms of definitely orientation, immediate recall, concentration, problem solving, more advanced cognitive skills, like writing checks, managing medication. So we're looking at kind of all the areas and not just memory. Plus, we are looking at language as well to see if the patient has some word finding issues. So once we go through the full neurocognitive assessment and we actually determine what stage the patient is at, being 1 normal, 7 profound, then it's very important to have that caregiver a part of that entire staging and neurocognitive assessment. At that point, if we feel like we do need an MRI for imaging, that is something that would make it obviously quite a bit more detailed in terms of our assessment. And pending the type of dementia that we see, we'll see cerebral atrophy in the areas of the brain that are affected from the disease. Next, the most important point, again, is the caregiver to make sure that they understand everything that we've assessed, why we've assessed it, putting a care plan in place, and then also making sure that we're following up on a patient at least every 6 months, sometimes every 3 months, depending the type. Also, it's also very important during the neurocognitive assessment to determine, here's where we're at, but here's what's coming next. So that way the caregiver is going to be able to prepare for things like behaviors and sundowning and some of the other physical abnormalities and deficits that we see in dementia. So as you can see, it is quite complex, but we have to make sure that we are detailed in our assessments. We utilize imaging and also making sure that we do have that caregiver present during the assessment and also the diagnosis. So again, there's not like a clear-cut guideline do this, do this, do this, and we'll have a diagnosis. It is more so a compiling of multitude of different testing and also imaging to get that accurate diagnosis. So again, I'm really excited about the part series that we have coming up. Keep the questions coming in. Love all the views that we're getting, and we're going to talk more about symptom management. And also, I get a lot of questions on sundowning, and also behaviors and medications and different environmental things we can do to help treat that. So we're going to make sure we get to all those questions. So again, appreciate it, and we will see you all again next week. Thank you.